Doctors at UAMS are pleading with the public to help open up beds.
Besides getting the vaccine, doctors say COVID-positive patients can get a special infusion to help minimize symptoms.
Jessica Rank is live outside of UAMS for us tonight. And Jessica, what can you tell us about this treatment?
Yeah, Laura, well, it was originally just offered to a small group of people who were considered high risk for this virus, but hospitals are now opening that up to serve more. Now, the infusion is supposed to lower symptoms, but it's also supposed to decrease the risk of hospitalizations for some by 70%. Karen Sullivan is spending her last few weeks of summer vacation inside.
I tried to do all the right things, got the vaccine, tried to do what I was supposed to do.
Sullivan tested positive for COVID-19 last week.
Don't know where it came from or how it happened, so that was hard.
She says her symptoms were mild, but doctors still suggested she get what's called an antibody infusion.
I'd heard about them before, but I didn't know it was an option for me.
The procedure hooks up the patient to an IV, transferring over COVID antibodies. And doctors at UAMS say it's supposed to keep higher risk people out of the hospital.
If you got this treatment, you had about a 1 in 100 chance of being admitted. The patients who didn't get this treatment had about a 1 in 20 or 1 in 25 chance.
Rolling up sleeves and getting the treatment is nothing new, but what is the number of people that now qualify.
We previously were doing 2 or 3 a day. Now we're doing 10 to 20 a day.
The FDA loosened patient criteria for the treatment, and UAMS says it couldn't have come at a better time.
It decreases risk of progression to hospitalization or death by over 70%.
Karen Sullivan is one of many to get the infusion.
Whatever I could do, I said, I'd be ready to do it.
She's happy it kept her out of the hospital so she can look forward to more days spent outside. Now, the big question is who can get this treatment? Well, there's a long list of people who are on that list of qualifications. I'll just name a few. People over 65, people with diabetes or kidney disease as well. But like I said, there's a long list that we went ahead and posted on our website. Now, UAMS also says you can contact your doctor if you have any other questions or would like to set up an appointment. Live outside of UAMS, I'm Jessica Rank for KARK 4 News. Guys.
Definitely going to want to check that out. Thanks so much.